So if you have a preoperative visit with us, scheduling a hip or a knee replacement, we'll have you come into the office and you'll typically meet with me or one of the other PAs. We'll spend a good bit of time with you explaining everything. What we'll do first is we'll pick a location for your surgery. We operate at multiple locations, and we will, whichever you feel comfortable with, we can sit and kind of discuss which place you would like to have your surgery. Then we'll pick a date. So we'll pick the date, we'll pick the place with you. Then after that, we'll kind of go over what happens in the surgery, what to expect before, what to expect after. Again, we'll talk about clearances. We'll get your doctor's names. That way we can make sure that you're set up with your primary and your cardiologist. We'll go over consent forms. We'll go over, risk of surgery, any type of questions that you have. We'll also go over medications that you'll have to stop before surgery. We will talk about medications that you have to be on post-operatively. And to make it easier for the patient, we will give you all a packet. So all the information that we're talking about in your pre-op, it's going to be all written down for you, nice and organized. That way you won't get overwhelmed, because we know you're nervous about surgery. It's a lot to deal with, but we'll make it as smooth and easy as possible for you. We'll have it all in a packet that you can go home with. You can read over it again once you get home. If you have any questions once you get home, our number is on the front of that packet. You can call our office and we can answer any questions that we may have left out, any questions that you forgot to ask. So we're always available once you leave that pre-op visit, where you can call us back and answer any last minute questions or anything that you get confused about. So we try to make the process as easy as possible for you. We really like to sit down and spend a good bit of time with you during your pre-ops to answer any questions that you may have.